Hello and welcome back. In today's video, we're talking about something that may seem minor on the surface, but can have serious, even life-altering consequences: a patient fall. It's important to understand that a fall is not just an accident, it's a serious safety event. Falls are one of the leading causes of injury and death in older adults. According to the CDC, each year, 1 in 4 adults over the age of 65 experience a fall, and many of these result in hospitalization, permanent loss of independence, or worse. Now let's break it down. Why is a fall such a big deal? First, from a medical standpoint, even a minor fall can cause major damage. A slight bump on the head could result in a brain bleed, especially dangerous in patients on blood thinners. A fractured hip or wrist can lead to long-term immobility, infections, or even the inability to return home. And the trauma isn't just physical. Many clients never fully recover their confidence, leading to fear of falling again, social isolation, and rapid functional decline. Second, there are legal and regulatory implications. In long-term care or adult family homes, a fall often triggers a chain reaction: incident reports, nurse or physician notifications, family communication, and sometimes even state investigations. Falls that result in serious injury may lead to licensing penalties, lawsuits, or insurance claims. For nurses, repeated or unreported falls can damage your professional record. For caregivers, it may result in retraining or even termination. Third, and I think this is often overlooked, falls signal system failure. They often point to a breakdown in supervision, environmental safety, communication, or even delegation. Was the client a known fall risk? Were assistive devices used correctly? Was staff properly trained? Did we have a clear care plan in place? These are the questions facilities and nurse delegators must ask every time a fall occurs. A fall is like the tip of an iceberg. What you see is the person on the floor, but underneath that moment are layers of missed opportunities, risks, and often preventable factors. So what can we do about it? We can plan for it. Prevention starts with awareness, because you cannot fix what you don't see coming. First, make fall risk assessments a regular part of your nursing delegation and supervision. Don't wait until there's a problem. Do a quick but thorough risk check when you see your client. Look at their medications. Are they sedating? Review mobility. Are they using the right assistive devices like a walker or a cane? Check the environment. Are there loose rugs, poor lighting, or clutter? Document these findings so everyone on the care team is on the same page. Second, teach your caregivers to recognize red flags. Caregivers are your eyes and ears 24/7. Train them to notice early warning signs. Signs that a resident suddenly feels dizzy or lightheaded. Maybe they seem unsteady or start furniture walking instead of using their walker. Are they more confused than usual, especially at night? Have they had recent medication changes or illnesses? When caregivers know what to look for, they can speak up before a fall happens. Third, create a culture of speaking up. This one is huge. Staff should never feel like they'll get in trouble for reporting safety concerns. Encourage open communication. If someone sees a resident trying to get up alone when they know they shouldn't, speak up. If the environment seems unsafe, like wet floors or poor lighting, fix it right away. If staffing feels stretched too thin, let leadership know before something goes wrong. When caregivers feel empowered to speak up, you can catch problems early. Fourth, follow up after every fall, no matter how small it seems. Even if the resident pops up and says, "I'm fine," do not brush it off. Be sure your caregiver knows how to do a quick situational assessment, not a patient assessment. Document everything and then go deeper. Think, why did this happen? Could it have been prevented? Situational assessment examples are something like, was the resident wearing proper footwear? Were there grab bars in place? Did confusion or medication play a role? Was the care plan being followed? This is not about assigning blame, but it's about learning so the same thing doesn't happen twice. Finally, make prevention a team effort. Nurses, caregivers, families, administrators, everyone has a role to play. The more eyes and voices focused on safety, the fewer surprises you'll have. Falls aren't always preventable, but many of them are. And how we respond to them before, during, and after makes all the difference in client safety and professional accountability.